Major pharmacy chains are beginning to stock their store shelves with the first over-the-counter medication available to reverse an opioid overdose. People with substance abuse issues and their relatives or friends have not had easy access to Narcan. Joining us to discuss this new availability of this medication without a prescription is Dr. David Pearce. He's the Chief Medical Officer for the City of Houston. Good morning. Thanks for talking to us.
Hey, good morning. Thanks for having me back.
Yeah, so tell us, I know that Haley Hernandez, our medical reporter, talked a little bit about this in the last couple weeks, but talk about the need for an over-the-counter version of this life-saving medication. I mean, when somebody would use it, I mean, how great this need is right now.
Yeah, so, narcotic overdose, opioid overdose is a huge problem in America. So the last full year of data we have is from 2019, where 50,000 Americans died from an opioid overdose. Now, here in Houston, we know that in 2020, just last year, between the health department and fire department statistics, we know there were about 1,350 opioid-related visits to hospitals. So that's almost 4 a day. And that's increased just in 2 years from 2020, when that number was only 795. So you can see these numbers are growing really, really fast. We also know that bystanders are present about a third of these of the overdoses, and so one of the key things about Narcan, or the naloxone spray, is that it's very easy to use, and bystanders can use it. It's just a simple spray in the nostrils. And years ago, it had to be given intravenously by paramedics, but now bystanders can give it and save a life.
Yeah, and so that's exactly what Haley had mentioned, and because the recommendation there was, anybody could go buy it and carry it, because again, if you're a bystander and see someone in distress or possibly overdosing, that you would be able to give it to them. I mean, who really should carry this around?
So, opioids are medications that are prescribed by doctors generally to reduce pain, and you get them after surgery or an injury or something. But there are other opioids that are available, and these include the street things like heroin. And then you get, on the street, people are buying what they think is oxycodone or hydrocodone, and generally those are laced with fentanyl. So and these are very addictive drugs. So, one of the things we want to have people do is just, only take medications that are prescribed to you by a physician that you get from a pharmacy. Now, should you have a problem, Narcan actually blocks the opiate effect on your brain, because in an overdose, it'll cause your brain to basically shut down. You'll go unconscious. It will actually impact your breathing center in the brain, and you'll start, very slow, shallow breathing. And if somebody doesn't do anything or we don't get help, you can go completely unconscious, and your heart will eventually stop if you're not breathing. And naloxone is very effective, and it's not addictive, and now it's available to the public.
Yeah, and so then that exactly was the question, not who should get the opioids, but who should carry around this Narcan. I mean, as an individual who may not know anyone or have any relatives who use opioids, I mean, should just regular people carry them, or is there some sort of risk of trying to help a stranger?
Yeah, so there's really no risk in trying to help the stranger. I mean, if you have reason to think it's an opioid overdose and you have the Narcan, this is why we recommend that people who use opioids, they should have it with them. And actually, what I tell people, you should have it with them. You should have it in your home. You should have it in your car. You should have it around wherever you're going to be. Make sure your friends and family are aware that you have it, or make sure that they have some and that they know how to use it. It's very, very easy to use. It comes in a little container that's got a little nostril injection port, and you just slide into the nostril and you spray it. And then on the other side, give the person about 2, 4, maybe 5 minutes to see if they're going to respond to a reaction. If they don't, you can give another one. And so what do you look for? So people are going to become, very sleepy. Very often they'll get tiny, tiny, tiny little pupils. Shallow breathing, maybe they'll start gurgling a little bit, they'll be limp, and if they are breathing too shallow for too long, their skin color will change, they'll start turning blue, and their skin will actually get cold. And if they're not breathing at all, then you need to start CPR.
Okay. All right. That's very good information. And then about the Narcan, the over-the-counter, because I know normally if it's a prescription drug, you're getting information from the pharmacist. But if you're buying these, I mean, how should you handle them? Could you carry it in your purse? Should you not keep it in your car in extreme temperatures, or things that might make it less effective?
Yeah, so all medications are subject to extreme temperatures, right? So you want to keep them someplace that's going to be normal temperature, so inside in a home or something. You can keep them on you. If you're somebody who's at risk, or if you're a family member of somebody's at risk, you may want to keep it in your purse or in your pocket or whatever you carry with you. Keep them in the home. If you keep them in the car, and I often recommend to folks that, you keep it in your glove compartment, it may get hot in there, but the only thing that'll happen is that if you use it, it may lose some of its efficacy. It doesn't turn into poison or anything like that. It may just not work as effective. So if you're going to keep it in your car, you may want to change it out more frequently. But otherwise, wherever you hang out, that's where I would keep your Narcan.
All right, very good information and hopefully life-changing for so many people. Thank you, Dr. Peirce.